You probably noticed like the thumbnail has probably looked different. I decided to go with purple because of that new possible wave 4 of coronavirus, and of course the stuff is getting worse. So here we go. So today we have some. We're back to like the under 300,000 coronavirus cases. Okay, cool. Okay, but what I'm going to talk about is oh yeah, some local problems with the corona that has to do with coronavirus, and it's not good news. So anyways, we have 2,716 which is like an exactly like minus 500 compared to yesterday's number, which is 3,216. You notice how the last two digits are the same. So yeah, there's that. It's coronavirus day 424. Stay at home day 333. And of course, today's case is looking at it. $807 is from Toronto. 707 high cases was from Peel Region. So both of them are still in the high. So both so Toronto and Peel Region. So it's 100 cases apart. So of course Toronto's in the lead as usual, and you know. And the reason because of this, as reported by Toronto police, is people having gatherings when they shouldn't be. So, so Officer Randy Carter has been very frustrated with this, and locals have been noticed this too. So the locals have been. Who have noticed this, and people having gatherings reported it to the Toronto police, and of course Toronto police took care of the rest. So 294 is from York Region, 168 from Durham Region, and 106 is from Hamilton. All other regions reported under 100. Okay, so we're back to that. 19 deaths have been reported today. Of course, I'm going to start with variants first. So, unfortunately, variants have increased. So, UK variant is at 93,263. So, in the lead. Well, the most dangerous variant known to mankind. an increase of 1,639, 511 South African variants, okay, which is increased by 111, so, and Brazilian variants are at 1,158, which is an increase of 329, and the India variant is still at 177. If you, but of course, Health Canada ain't looking at that because it's not a variant of concern. But to me, variants are variants. It's a danger to our society. It's affected the people in Brampton. Affected people in Ottawa more. And my condolences go out to the people in Ottawa for, as so two people, as mentioned, who ended up bringing the India variant into the country from either India or Pakistan. We don't know. It didn't really specifically say, but so two people are quarantining like good citizens. However, one person ended up in Greater Toronto, Hamilton area. And you know what that means. Trouble. And of course, the India variant is, and coronavirus cases and if you look at India right now, India contributes to at least almost 50% of all coronavirus worldwide cases, and at least 300,000 cases daily, and of course cremations and body burnings have been involved, and it's just sad. And so, Doug Ford has suggested sending ventilators to India to support Indians in India who have been infected in hospitals. And they have been sent. So, the first topic I'm going to talk about is vaccinations. So, the Ontario government says starting tomorrow and starting at 8 a.m., people with at-risk health conditions such as dementia, diabetes, and sickle cell disease will be able to book a vaccine appointment. Also tomorrow, people in Group 2 who cannot, basically people who cannot work from home, like that includes grocery store workers, like cashiers, stuff, people who stock shelves, and and work storage, restaurants, and transportation workers will also be eligible to get a shot. So starting Thursday, May 13th at 8 a.m. People who turn 40 years of age as of this year and older, and non-hotspot areas will be able to book a vaccine at a mass immunization clinic. So they can book a vaccine. So finally they can get immunized again. So those who are eligible can book they can book a vaccine either the website or the toll-free number, or through the local public health units that use their own booking systems. Yes, this is a thing. Apparently, some. So Ontario said due to an increase in supply, high-risk healthcare workers, dialysis patients, and all First Nations, Inuit, and Métis individuals can book their appointment to receive their second dose earlier than the 4 month, than the actual 4 month, about approximately 112 days maybe ish. So on May 2nd, it was mentioned vaccine eligibility is expanded for those 18 and older in hotspot areas based on certain postal codes. Which is very confusing. But Peel Region plays smart, and they allowed vaccinations for everyone 18 and up. So I got the description down below for full list of group 2 people who cannot work from home. And of course, if you want to get vaccinated, details are down below. However, my second topic involves Cobourg police. So apparently a gathering in front of Victoria Hall in Cobourg over this weekend. I saw this on a Facebook post by a certain somebody who talked trash about me. So anyway, a gathering happened during the weekend, which led to police issuing they had to fine them using the EMCPA rule. So the Emergency Management and Civil Protection Act. So it happened on Saturday. So Cobourg police said that they found at least 7 to 10 individuals gathering in front of a Victoria Hall. of course, this is not the first time we've heard of problems with Cobourg, and that happened in Cobourg with people trying to do anti-lockdown, anti-stay at home, trying to trying to. These are basically like what you call people who act like their own rights are more important than basically every single other citizen that lives around them. And instead, so this is like how instead of making an improvement by actually following the rules, and which would decrease cases, and of course we could get out of this much faster. And I'm quite sure, and I have to mention that the stay-at-home ends Wednesday, May 19th, which is next week. So the Cobourg police is trying to limit the spread of the coronavirus, of course, and also variants. They don't forget the variants either. And they're working with in partnership with Town of Cobourg, they will be be proactive and anyone who's trying to break the rules, they will have to tell them to go, leave, and of course $750 fines will be given out for each individual who is yeah. So residents who in Cobourg, if you're watching this and you're in Cobourg, if you want to, or yeah, if you have a concern or complaint regarding possible violations of the people breaking the coronavirus regulations and the stay-at-home regulations, you can call the Cobourg Police Service at 905-372-6821. And not to mention, so not just Cobourg, but Portal had issues with people fishing in our area, and it's always people from Toronto. It's always people from Toronto, or Markham, or Woodbridge, or Vaughan. So the EMCPA, so it's how this works is $750 charge for every single person who is breaking the lockdown rule or the stay-at-home rule, or both, maybe both. And it depends. Sometimes they might get additional $130 surcharge, which adds up to $880 each. So $880 if yeah, sometimes and also if people they get caught doing this in a car, and Timmins police also caught these people doing this from Brantford, and they were doing a ride check, which is 100% legal. So each person in that car, there was 5 people, they got charged $880 each. You do the math. $1,000 for preventing others from following, regulations. You know, those anti people. Yeah. Yeah. And $1,000, like $10,000 for those who organized or planned the gathering. So, yeah. You know, like what they say, play stupid games, win stupid prizes. If you're going to do the crime, you want, and also additionally, it has been mentioned by the government of Ontario, if you are like literally break a rule, like if it gets really serious, you might have to pay a higher fine, or you might have jail time, according to the government of Canada. Of course, I'm going to talk about hospitalizations. So, hospitalization, I think it's gone down to 1632 people hospitalized with coronavirus, which is down by 8, which is a tiny bit. Like that, 828 ICU patients, minus 20. I just hope it's the critical care nurses are doing okay. Dealing with patient numbers. Because I have a feeling I know what they feel like. And 547 of them ICU patients are using a ventilator, which is minus 33, lower than last time's number. Okay, long-term care home deaths have been revealed again, and it has decreased to so it's a minus 1, 3,762 deaths. Of course, the number of staff deaths has not changed since months, and 45 outbreaks. So compared to the outbreaks is at 45, which is compared to last time's number is minus 5, unlike what they're showing me right now. So some people might still think, oh, the government's being unfair to us. We need our right freedom, which is what I've been seeing on social media. But let me tell you, like, in this kind of way. So maybe like you have a gathering with like some people. Could involve some family members, some friends, someone you're dating, someone you're in love with, someone like, you know, family, you know, someone you care about. And then you find out weeks later that that person has coronavirus or there's variants. Sort of like, you'd sort of like probably, like, you know, you gotta think about it that way. You gotta think about it that way. That's why having any gatherings right now is absolutely not even a good idea. Even after like the first week of like, when we're free after May 19th, or maybe it's extended. Who knows when. So please follow coronavirus safety rules and regulations and stay-at-home rules. Absolutely do not have any gatherings of any kind. You are basically ruining it for like people you care about, and basically the community and the region and entire province and entire country. So if you're like going across the Ontario Manitoba or Ontario Quebec border, please follow the border uh, rules for essential reasons. I have the rules down below. So to those uncivilized people who still don't understand, your rights aren't more important than the rest of us trying to lower coronavirus cases and ICU patient numbers. Because even doctors and Dr. Teresa Tam and people all the healthcare professionals all the way across from Canada, from British Columbia to the out east to the Atlantic, they've all said in the fall we might have a wave 4 of coronavirus if things don't lighten up. Stay safe.